I have the great pleasure now of being joined by DDW Council Chair, Dr. Grace Elta. DDW 2016 underway. How exciting.
Very exciting.
And what are the focuses this year?
So the focus every year is what's the latest updates in clinical medicine, in gastroenterology, and in research in gastroenterology. It's always hard to pick out individual focuses, but I think some of the exciting things this year are the microbiome. That continues to be a very hot topic. There's so many diseases now that are being tied to the gut bacteria, and that altering those gut bacteria may alter those diseases. So that's very exciting, and we continue to see more research on that. Another area that's expanding dramatically is inflammatory bowel disease treatment. There's just so many new biologics on the horizon, which is really good news for those patients. Because historically we've had very few treatment options, and I think the new treatment options that are coming, everyone wants to hear about them because these are relatively common diseases. So those are two things that stand out. Certainly there's been tremendous progress in the last few years in treatment of hepatitis C, but the other sort of big liver disease on the horizon is going to be fatty liver disease, which is so common due to the obesity epidemic. So I think that's another tremendous focus this meeting.
I think it's so key for everyone to come together, and what they learn here, they're able to bring to their patients in a really powerful way and feel like they're doing them a better service.
Oh, I agree. You know, this is the largest meeting in the world for gastroenterology and hepatology. And so there's just so much clinical medicine and so much research going on and so much you can take away from the meeting. It's very exciting.
Can you talk about some of the biggest challenges right now in the field?
I think the biggest challenge in medicine in general, and certainly in gastroenterology and hepatology also, is cost containment, because it's clear that we can't continue to afford to do what we've done, which is in the United States do everything regardless of cost. That's nice in some ways, but it just isn't realistic, and I think that's going to really be a real challenge to us. So I think a lot of the research this year is focused on cost issues. What is the value of this treatment? Because patients are starting to shoulder more of those costs too, and they're going to be asking those questions. Is this worth it? So I think that's going to be a huge challenge, and it's going to take research. It's a different type of research. It's not like what's this new drug, but it's still going to take us research to decide what treatments are cost effective.
All right, from the challenges to the things that you're most excited about.
Well, I'm an interventional endoscopist, so the things I'm most excited about may not excite most of the attendees, but I think the interventional endoscopic ultrasound, we're really starting to do things that only surgeons did historically. And so there's some fascinating papers at this meeting on that topic, such as creating enteric anastomoses endoscopically, draining not only pancreatic pseudocysts but other organs that we've never been able to drain, all endoscopically. And of course, there's an explosion of bariatric treatments that are endoscopic too. So I think all of that is very exciting.
And then what do you think will surprise people the most at the meeting this year? Any changes?
Yeah. The biggest change this year, which really is new, I've been coming to DDW for over 30 years, is that the posters are now grouped by topic, which I think is going to be great for the attendees. In the past, they were grouped by society, and there's a lot of overlap between the societies. So if you wanted to see posters on pancreatitis, you had to go to the Surgical Society, the ASGE, and the AGA, and they were all on different days and different sessions. Now it's going to be really grouped by topic, and I think that's going to be a great benefit to the attendees. Also, the oral sessions and the abstract-driven sessions are all going to be tracked also. So if you're interested in a particular disease topic, esophageal disease, you can search by track. You can also search by day and other ways, but I think that this new grouping of the meeting is going to be brand new and really a benefit to the attendees.
And it was truly a Herculean effort to get it all organized, but in the end is going to be so much easier.
I agree. It's a Herculean effort because historically the four societies produced their own sections and then they were sort of pasted together in the meeting. So to try to integrate that by topic is hard, but the DDW staff did a great job on that.
I'm so glad they did. Thank you so much.
Yeah, thank you.